Assalamu alaikum, hello and welcome to the Health Show here only on the Islam channel with me, Alistair Greener. Tackling health problems every week, we're joined by a health expert within their specialised field who discusses the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show, and we really hope that this will help guide you in the right direction. So if you suffer from any medical issues or have any health concerns, or if for that matter you know anybody who does, then do tune in each week as we'll be covering a wide range of topics and offering alternative viewpoints from our health experts. If you'd like any further information on our programs or any of the topics that we discuss, then please do get in touch. healthshow@islamchannel.tv. Today we're looking at cupping. Now that's also known as hijama. Now to discuss this topic, it's a real pleasure to welcome Sondoss Zaouali, who is a qualified medical nurse and wet cupping therapist. She spent over 10 years in nursing, covering a variety of specialities. She discovered wet cupping therapy, which is also known as WCT, a few years ago and became fascinated by it. She has since being trained to carry out wet cupping therapy by doctors who are experts in the field, and her medical knowledge allows her to understand the science behind wet cupping therapy and to stay in touch with the latest research. Sondoss, thank you so much indeed for coming on the show.
Hello, and thank you so much for inviting me.
It's a great topic and we've got lots to talk about, but just before we do that, let's give it a little bit of a background. Cupping therapy is an ancient form of alternative medicine where a therapist puts special cups on your skin for a few minutes to create suction. People use the treatment for many purposes, including helping with pain, inflammation, blood flow, relaxation and general well-being, as well as it being a type of deep tissue massage. Let's take a look at a short clip which shows how popular the practice of cupping is in China.
Cupping has a very long history in China. It has thousands of years of history. We target the body's internal organs because our body has a lot of pressure points. It's known that the body has 361 pressure points. Why is cupping good for athletes? Because it can help them heal quickly by promoting blood circulation and easing swelling and pain. Especially the pain, you can get good relief. Normally our clients tend to be older, like the white-collar crowd, people who exercise relatively little or have some minor illnesses. We will help them with that.
It's fascinating watching that clip because it's such an ancient art and it's actually done differently in different parts of the world, isn't it?
Yes, it's surprising to see how each culture finds some different ways to apply the same principles. So some people will use some glass cups. Some other was even using some horns and doing the suction with their mouth actually. So it depends depending on what was available for them there.
Now, how old is this? It really is a very ancient therapy, isn't it?
It's a very, very ancient therapy. We found some traces of cupping therapy in all the continents. We don't know exactly where did it come from. However, the oldest document that we found is from the antique Egypt. So far, we say that the starting point was there.
Now, describe what the main philosophy behind cupping is. How does it actually work?
Okay, so the way cupping work is, I'm going to talk about the wet cupping mainly,
Okay.
the hijama. So the wet cupping is actually a two-step process. The first step, when we do the session on itself, we do apply the cups on the skin to collect some of the toxin just under the skin. So we apply the cups for a few minutes, and after that we do some scratches to allow some blood to come out. The blood which comes out is naturally filtered by the body, and the bleeding will stop on its own. So in that we say that it's a very natural medicine. We don't really do anything to the body. We ask the body to do the job. That's the first step, so the withdrawal of some toxins and some let's say bad blood at the moment. After that, the body will start a great general healing. Some research shows that a couple of weeks after the cupping session, a wet cupping session, the white cells increase significantly. So that means that it boosts the immune system. And in that sense, it can help for so many different conditions. So the idea of the cupping is to boost the immune system.
And so, first of all, by getting rid of the bad blood, and then by boosting the production of white cells.
Absolutely.
How does, the thing that fascinates me is how does the body know that when you use cupping to then send the toxins to that particular point where you're cupping?
You mean how the body knows that it gets the toxins, let's say, ready? It's just a difference of pressure. The difference of pressure makes it, because we pull up the skin, the body clearly understands that something's going to happen right there, so it's just pulling up. It is a lot about pressure as well.
Now, these particular points, which we heard on the video there, they're all known in different terms according to where you are. And of course, for many of our audience, they'll be familiar with hijama. And there's a lot of terminology around hijama as well. For example, the different points where you can get best access.
Yes, so hijama is simply the Arabic word for cupping. Hijama literally means suction. So that's it's just different languages, basically. The different points, yes, definitely. In hijama field, so let's say the Islamic way, there are 13 key points which we believe are very, very beneficial. The rest of the points, it depends on what kind of background we have. We can even use, some of the Chinese medicine points as well.
The initial consultation, how long will that take, and what sort of things will you ask?
Okay, so the consultation completely depends on the patients. Some patients have a long medical history, so that might take a bit more time, and some people don't have much to say at that point. So the consultation aims to go through the medical history to assess the risks, basically, of the session, to ask about the different complaints that the patient might have, different kind of discomfort. That is the first thing. The consultation also allows us to choose which point we're going to treat. After that, if it is the first time, we will explain to the patient what is the cupping, what is the wet cupping, what they can explain, what they can expect, and most importantly, I will tell them that they can stop the session at any point if they don't feel confident or comfortable.
Because that's actually an interesting thing, having seen it happen before firsthand. Actually, it looks like it might be not very comfortable, but actually it really isn't uncomfortable, is it?
It's not, actually. That's one of the points is it's scary to look, especially the wet cupping with the blood. It's completely scary, and I always hope that my patient didn't check on YouTube or on the internet before they came to see me. But actually, it is not a painful procedure. It is uncomfortable and quite weird, because like someone pulling your skin on your back is not something that we're used to. But apart from that, it creates a discomfort more than a real pain.
Actually, one thing we should mention is the difference between cupping and wet cupping. What defines wet cupping?
So there are many types of cupping. There is the wet cupping, there is the dry cupping, there is the massage cupping, there is the pulsatile cupping, many different. Cupping simply means that we use cups. Okay, now what we've seen on the show is the dry cupping. So that means that we don't do any. There is no liquid coming out from the skin. The wet cupping, we will start the same way, and after we'll do some few scratches, very superficial scratches on the skin, and reapply the cup to allow some blood to come out. That's the main difference.
That's the difference.
Yes,
okay.
Exactly.
So there's much of interest with dry cupping. How does that, but if you're not releasing any of the blood, how does it still have a benefit?
In the same way that we do collect the toxins under the skin, and then your body will treat it like a bruise. Simply, it will get rid of all the toxins via the lymphatic system,
right,
mainly. Okay. The people who have the main difference, the main difference between the wet and the dry cupping is that indeed with the wet cupping we release the blood straight away, so we make things easier for the body.
So it's just a different way of releasing those toxins.
Exactly.
So let's come back to the session. So we've been through the analysis, we've checked that it's suitable, it's okay. What about the application of the cups? How many cups would you normally apply? How long are they left on there for? How long does the session last, or so on?
Okay, a session lasts on average 1 hour. Okay. So then to choose the points where we're going to apply the cups, there are some general points which are good, to do regularly. And after, it all depends of why the patient is here. If the patient has a migraine, I might apply some cups close by the head, or maybe even on the head. If a patient has arthritis on their knees, I might apply some cups around the knees. About how long I leave the cups, it basically, the body will say. So I will allow some time, few minutes, for the blood to be collected under the skin. And once I do the scratches and the blood starts to come out, the amazing thing is that the bleeding will stop on its own. So this is how I know that I can just wipe everything and end of the session for that point. Now the bleeding time might differ from one person to another, and it will differ.
And how long does it take before the skin goes back to normal?
In terms of coloration?
Yeah.
Or in terms of, it depends how dark did it get beforehand when we first apply the caps. For the same patient, the skin might get very dark, for instance, around the shoulders, and very pale around the hands. It depends. The more we say that the darker the skin gets, the more toxin there was there. And then it's like a normal bruising. If I hurt myself, if it's just red, in a few minutes or even a few hours, it will be completely gone. Now, if I've got a very bad bruise and it went purple or black, that will take much more time.
Okay, now what about the individual? Is there anything that they have to do in terms of preparation? Is there anything that they eat? Do they have to drink more water? Do they have to take any exercise, or pre-existing conditions? Okay,
so that's an excellent question. Before the session, we ask patients not to eat. Okay, it's like not to eat for between 2 and 4 hours. The reason of this is that we would like to stimulate the blood flow, especially on the areas that we would like to treat. Now, today we know that the digestion requires a huge blood flow. So if we keep the body busy with a heavy digestion, the blood, will be focused on the digestive system, because that's the priority of the body. So that's why we ask them not to eat that much. However, it's important to have some extra water, because they will lose some fluids. So it's important that they have enough and even more for them to be safe and fine during the session.
Now, are there any people who shouldn't have cupping done? For example, maybe pregnant women, people with certain conditions or anything like that. Are there any restrictions?
Okay, so the research about the wet cupping are quite limited at the moment. So what we say is that we use the precautionary principle. That means that because we don't know, some people we say it's better not to. For instance, pregnant women, we say it's better not to have the cupping, not to have the wet cupping. However, there are few exceptions. If a pregnant woman twists her ankle, I've got no reason not to treat her ankle very locally over there. Okay, so in general, we say better to avoid, but sometimes people with hemophilia, we will not treat them. Completely not, because, I mean,
of course.
We don't want to, the point is to treat people, not to harm them.
And what about age? Is there sort of like a beginning age, and is there an upper age limit for it?
In theory, no. In theory, I mean, we can treat patients up to very old patients. However, they will not tolerate the session in the same way. And we know, for instance, that the wet cupping vary the blood pressure. So we need to take it very, very easy with their heart. In that case, we will apply just very few cups for them. And very young, there must be really, really good reason, but most importantly, we say kids are afraid of that, especially because they are not really seeing their parents or whatever doing it. So we don't want to scare them. We say, okay, you're happy with the symptoms that you have, that's fine. Grow up a little bit and then come back to see me.
And what age would people normally think about cupping?
It's not about an age, it's about trying something for them to feel better. If they think that, okay, I mean, is there an age to go to see the GP? Not really. So it's more like, okay, if I haven't gotten a good answer with my GP, or I don't want to take any medicines or whatever, I will try something else. So whenever people feel ready to do so, that's when they can come.
You mentioned earlier on a huge variety of conditions that cupping can actually help with. Give us an outline. You said before that sometimes within 2 weeks there was a noticeable difference in various conditions and things. Give us some other indications. You talked about migraine, you talked about 1 or 2 other things like arthritis. What else?
Migraines, arthritis, difficulty to conceive. We've been helping a lot, digestive issues as well, with IBS, constipation, heartburn, and so on, asthma, any kind of joint issues, restless legs, varicose vein. The varicose vein, just to make clear, we do not remove the varicoses, but we help with the symptoms of the varicose, so the heaviness, and it can be the stress, the anxiety, the depression, the feeling very low, and so on. And the result can be shown, actually, can be felt straight after the session. Very regularly, patients say, oh, wow, I just feel lighter, actually, and feel better within myself straight after the session.
What are some of the misconceptions about cupping that maybe people don't really understand, that this is a great opportunity to say, actually, it's not quite what you might think? Misunderstanding within the community, for instance, some people will say that it is a sunnah, it is a tradition. So they will come, or they will have wet cupping done, even with no symptoms, saying that, oh, it will just protect me or prevent my good health. When in reality, we do not have any, in the Islamic text, I mean, we don't have anything which says that, okay, do cupping to prevent. Actually, the preventive is more like your lifestyle, the way you eat, the way you sleep, if you exercise, and so on. So people sometimes just come and say, oh, it's just because it's a sunnah, it's just because it's tradition. Why not? I'm sure I'll find out, I mean, that there is some few things which are not completely fine, but that's a common misconception. Is there anything that people can do to make the most of their cupping session in terms of maybe exercise beforehand or diet beforehand or anything like that? Is there anything that they can do to get greater benefit?
The main thing will be the water. The more water we drink, the more the body will be able to release some blood, so to release some toxins. If the body doesn't have enough blood for the normal functioning, it will not allow lots of blood to come out, so lots of toxins to come out. Really, the water is the main thing to do.
Now, obviously, with so many different areas of health that it can benefit, where are we in the UK at the moment in terms of doctors recommending cupping, or the general wider health service in Britain accepting it as a form of therapy?
Things are changing, but very, very slowly. So lots of people don't really know the difference between the wet cupping and the dry cupping. So it is difficult even for GPs to advise patients to go for it. The Chinese medicine is much more accepted today and even prescribed, acupuncture and so on, so which is a great thing. Now it is very slow. I mean, it's not a mainstream discipline at all. Some doctors will say that, well, this doesn't work and there is no research. The reality is that there are some research, but maybe they didn't look for it, so that's a bit different. And they say, well, it doesn't work. So the thing is, because we don't understand how it works and so on, the thing is we don't always, the point is not to understand. When I'm with the patient, my point is not to understand how it works, it's simply to release the patient, to make him or her feel better. So if that works, that is fine.
For somebody who's watching this thinking, you know what, I've got this condition or that condition, this actually sounds really interesting, but where do I start? How do I find, especially if maybe my GP isn't an expert about it, doesn't know much themselves, what's a good first step for people?
Okay, the good first step is to see what wet capping therapies there are around you. One important thing is to choose a wet capping therapist with a medical background. Because especially if you have few conditions or few symptoms or whatever, it is very important to keep you safe. So having a therapist with medical knowledge is really, really important. And then to just ring people and to see, I mean, if what they say makes sense, doesn't make sense, are they just relying on spiritual belief? Because there is a science as well behind the wet capping and so on. So just ring them and see how you feel. Have they been able to answer all your questions and just to make sure that you are confident, or have they not been able, and so on.
Now, every industry has people in it who maybe aren't as qualified, aren't as such at the same level of expertise as others. What kind of method is in place for you to be able to be ensuring that you're picking the right therapist?
That's a very difficult question, because today there is no regulation of the alternative or complementary therapies. So that means that anyone can claim to be a wet capping therapist, and even a professional one. If we look at some of the trainings available out there, they are a 1 or 2 days training. So I personally don't believe that this is right to be able to treat people. So the main thing is to ask about their background, where they have been working, how long they have been working, who did they qualify it with, and look at the website of the training course. Okay, some of them have excellent marketing skills. Okay, so don't pay too attention, but really think about it. Does this make sense to me? Okay, it's all good to tell me it's going to work. How does it work? Try to convince me.
Right. Well, we've got lots more to talk about, but in the meantime, we're going to take a break. But thank you so much so far. It's been fascinating finding out more. But as I say, it is now time for a break. But we must also stress that should you suffer from any medical problems or health concerns, it is always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. We'll see you after the break. Welcome back to the Health Show, where we've been looking at cupping. Now, according to Speakers Hub, cupping therapy has been practiced for centuries globally. The first documented medical text was found in 1550 BC in Egypt. Cupping was also discovered in China over 5,000 years ago and is still practiced to this day. It was commonly practiced in the Roman Empire, as well as the Islamic Empire, Europe, Russia, Central Asia, South Asia, and the United States. It was very popular in the Middle Ages and 18th and 19th centuries in Europe. And right now it's the most popular in China, Finland, Russia, and many Muslim majority countries. And to discuss all of this, we're joined again by Sondoss. And it's great looking at some of the equipment, and we should probably talk about this because it's been on the table since we started. And perhaps you could explain, because again, this is dry cupping. In our video at the beginning, we saw a different kind, which was using heat and different ways of doing it. So explain the differences between that system and this system.
So the fire will basically create the suction. Okay, they do rub the inside of the cups with alcohol and then put the flame to consume the oxygen. So no oxygen, I apply it on the skin, so that will create the suction. Okay, because of the vacuum created by the combustion. And it is just another way actually to apply to create the suction just manually via a pump. So it will be so like this, basically.
Excellent. Okay.
But the principle is the same. I do apply a pressure. So to use the fire, one needs to be very, very experimented. Okay, and it's not always. It's not. It can be. I mean, there can be some risks. So definitely.
This looks to me like to be a slightly more 21st century version. Now, what about the cups themselves? I see there's different sizes there.
Yeah, there are different sizes and shapes. So the sizes will depend on the area that we treat. If I'm treating the back, the area is usually quite big, so I will prefer a big cup. If I'm treating like the ankle or just the wrist, I will choose maybe a small one. Or if I'm treating, for instance, some parts on the legs below the knee, I would use a curved one just to adjust, I mean, to the anatomy of the body.
One of the things that I know people will be thinking is that, you know, we're applying this on the body, there is blood involved, there's particularly some hygienic issues that people might be thinking about, and certainly health concerns regarding having these cups and maybe having them reused or so on. Absolutely.
So the glass cups, they can be disinfected properly, so they can be reused from one patient to another. They can be sterilized, okay? This is plastic. This cannot be reused. This is disposable. I can be reusing them for the same patient during the same session. I can be applying it on the top of the bag, on the bottom of the bag, but at the end of the session, I must throw them away, okay? Because there is actually a rubber part here. The gray part is rubber, can be removed. And sometimes, if there is lots of blood, some drops of blood can be blocked over there. Even if I rinse it, whatever the chemical that I'm using, first I might damage the rub so that I won't be able to use it. But most importantly, I cannot have the guarantee that no blood has been stuck over there.
So if you have this therapy, you want to be assured that actually it's as hygienic as possible, is to see them coming out of a fresh packet as new.
Absolutely. It is a necessity, and for people, I mean, who visit patients, they should leave them there so patient can throw them themselves. There have been, I mean, unfortunately, some scary stories. I mean, I had a patient who came to see me and who told me, oh, that's the second time I had wet cupping done. I said, okay, when was the first time? She said, I didn't really like it because she wanted to use the bathroom before the session. When she went to the bathroom, she discovered lots of cups soaking in the bath. This is not acceptable, okay? Because sometimes people are aware that they have Hep B, Hep C, HIV. Sometimes people don't know. And whatever, we do not mix people's blood, okay? And talking about sterile equipment is simply a myth in cupping, because this can't be sterilized. It simply needs to be clean. I mean, the wounds that you create, the scratches are so superficial that I don't need, I mean, a sterile equipment. I'm not in an operating theater. So it simply cannot be. So there is, I mean, some hygiene issues and hygiene concern with some people practicing it, whatever it is for saving, I mean, a bit of money or whatever. It is not safe to reuse the same cups for different people.
And of course, as we said earlier on, you know, it's unfortunate at the moment it's not under any form of regulatory system. There's no licensing or anything like that. So It's really the only way to be sure that someone's going to be a good therapist is just to do your research first on that individual, see what else they've done and where they've worked. And ideally, I think you said that if they have a medical background, that's preferable.
It's almost necessarily, I mean, the medical background, not only preferable, because again, what is difficult with when we practice the wet cupping is to be able to say, I will not treat you, okay, specifically because in your case, the risk of the wet cupping are higher than the benefits. This is like in medicine. If you go to see your doctor, your GP or whatever, he will give you treatment only if he thinks that the benefits might be higher than the risk. If it's the opposite, he will say, no, that's not safe for you. So same thing with the cupping. If you don't have any medical knowledge, you're not able to say that.
Now, we talked earlier on about the different things that cupping can help with. One of the things I've noticed in all the videos we've seen and so on, we always see the cups applied to the back, but you imply that they also get put in other parts of the body. Why is the back almost like a preferable area to use?
Let's take it that way. When we work, when we do wet cupping, we work from the skin to reach the inner organs. Okay, the main inner organs are in the top of the body. How I can access them easily, it is from the back, of the heart, for the digestive system, for the kidneys, for the liver, and so on. So apart from the brain, but that's usually why people have hijama wet cupping done on their back, and also because alongside the spinal there is some energy and some important points. Another reason is that people do complain a lot about shoulder pain, back pain. So that's another reason to have to apply the caps over there. However, it's not limited to the back. We can apply the caps around the knees, on the feet, on the hands, on the arm, elbow, and so on.
Now, one of the things with cupping is the fact that it is very different, and we talked earlier on about how doctors are actually coming round to maybe talking about it and recommending it and so on. What about your experience? You know, as a nurse, as a practicing professional within the medical community, what sort of experiences have you had where you've been able to see people maybe go through some fairly incredible transformations as a result of cupping?
There are, I mean, so many examples, and although wet cupping is really scary, I can tell you that when people try it, they are so happy that they do come back. But before, it's like sometimes they tell me, oh, I wanted to come for years, but I didn't dare. I remember this patient, she's in her mid-30s now. She's been diagnosed with rheumatoid arthritis. Okay, so since she is 3 years old, okay, she's been suffering with very bad pain. She's 3 years old. She comes to see me. We have one session. We've got a second session. She goes for a usual checkup with her GP, and on her blood test, he tells her, well, your inflammatory markers are completely normal. It's like you have no trace of arthritis.
Incredible.
It is.
And it's one of those things, isn't it? It's always worth a go. You know, many people try different treatments, and for certain people, some things work, and if something's not else working, then give this a go. What about other people who shouldn't have it? You talked about haemophiliacs that you obviously won't treat for obvious reasons. What about people who are undergoing dialysis, maybe having cancer treatments? We talked about women who are pregnant. What about women at various parts of their menstrual cycle? Are there people who shouldn't be having this treatment or should consider it very carefully?
Okay, some people definitely will be in higher risk because we don't really know. There is already so much going on in their body that we can't really predict what's going to happen. People who are going through chemotherapy, people with diabetes, okay, depends. It's not an absolute contraindication, but it can be, depending how balanced and how controlled is the diabetes, how are they going with the diet, and so on. People with dialysis, we'll take it very, very easy because they are limited in their water income. So the blood loss as well might have an effect. They usually suffer with high blood pressure due to the kidney failure. So these cases we say, let's talk about it first, and we see, and most importantly, let's see how you expect. What do you expect from it? Because some patients come almost expecting and hoping for a miracle. I don't do miracles.
And again, that really comes back to what you were saying before about having a medical background and then being completely honest in that initial consultation to make sure that everything's covered.
You have to. You have to. I mean, I'm always just... it's horrible to hear, some therapists telling the patient, that's fine, you can stop taking your tablets because this is going to cure you, because the Prophet said that. That's not our faith. That's not our faith at all. Let's remember that the wet cupping existed before Islam, and the Prophet has been revealed that it is very beneficial, so let's carry on about it. And the Prophet has always encouraged the science to understand astrology, mathematics, physics, medicine, whatever. This is our belief. So if something is harming you, no, don't.
What about smokers? We hear a lot of, all sorts of different ways that people have tried to stop smoking, from patches to vaping to hypnotherapy. You name it. There's help offered for people who are smokers. What about cupping? Could that help smokers at all give up?
There's something important to understand about the wet cupping is that although we can treat the symptoms, but most generally we'll try to treat the reason of the symptoms. Okay, so that means that the reason what led someone to start smoking and to become dependent, I might not be able to treat that point. However, when people have an addiction, there is always a certain amount of anxiety, of stress. What's going to happen if I stop smoking? Mood swings. The smoking cessation is very difficult. In that sense, the wet cupping can help to release the pressure, to help them to go through this process, and also to get rid of some of the toxins, obviously.
I'm throwing a huge amount of questions at you, so thank you so much. You're doing incredibly well giving us all this information. One of the things that just dawned on me is if you've got skin problems, for example, eczema, things like that. And for that matter, talking about the skin, what about if you've got tattoos and things? Can you have it done where a tattoo is or anything?
By principle, we say it's better to have it around the tattoos. Now, it's not the cap on itself, but it's more the scratches. Sometimes people, especially women, they have some lower back tattoos on their lower back, but they do suffer with lower back pain. So what I do is that I apply the caps on the lower back, but to do the scratches, I will basically avoid the design of the tattoo. So I will be doing some extra designing there. So yeah, to accommodate, because I don't want to spoil their tattoo, obviously, and I don't want to risk anything. So same thing, precautionary principle, we stay away.
Excellent. Is there anybody that you have had as a patient who's come in who's actually surprised you, where you thought, you know what, I'll give this a go, what the heck, and actually it's had a remarkable result, maybe beyond what you were even anticipating?
Yes, I had this patient who tried. She's quite curious and quite happy to try whatever is new or she discovers. So she had some issue with her ankle for years and years and years. she was doing sports on a professional level, and she developed some knots on her tendon, okay, on the ankle tendon. And so this pain, came back time to time, especially when she was working and so on. We've done a couple of sessions, and a few months after, she went for a check and another scan. The knots were not there anymore.
Incredible.
It is.
Now, actually, it's interesting you talk about women, because women are always concerned, we find in the health show, about making sure that they can find therapists who are female so they can go to them and feel very, very comfortable with them, which you're proof of that, the fact that you're here, which is great. So obviously look and make sure. What about anything else for women, say, for example, as we mentioned, the menstrual cycle or anything like that? Are there any concerns there?
So what we say is that depending what we are treating, okay, about having wet cupping during the menses is already a blood loss. Okay, so what we say that it is safe. However, you can feel quite tired after the session. So if the first day of the period is quite difficult to bear, have some rest, let that go, and book an appointment for after or at the end of your period, so we don't overwhelm the body, okay? Because the period is already it's a huge work, for the body. It's not
we
easy.
Talked a lot about, what you can do to help yourself, and you're just saying about, fasting just beforehand and so on. What about afterwards? Are there any special foods or drinks or anything you should have that might actually help the whole process, and for that matter, help the healing process?
Yeah, so I think it's important that we talk about how can we feel after the session, okay? Because there might be some side effects, okay? The first side effects would be the skin, okay? The skin will be stretched, okay, quite a lot, so they can be a kind of a soreness that can be released with a bit of with oil mixed up with aloe vera gel, 1-2 days. That's absolutely fine. However, as a general feeling, some people might feel tired. Let's remember that the wet cupping is a self-healing process, okay? So if I am self-healing, it's like when I have a flu. If I have a flu, I will feel very, very tired because my body is trying to heal, build up new cells, and so on. The same thing can happen after the wet cupping. depending on how healthy or unhealthy we were before the session, we might feel tired, moderately tired, or very, very tired. So this is something that we need to expect. That's why we say if you're working with crazy hours, let's do that on a weekend, okay, because you need to have some rest. About the food, what we say is do not overload your digestive system, because the digestive system is always the priority. We want the body to keep, the blood to keep flowing and to keep refreshing. So what we say is stay away from any kind of animal proteins because they are very heavy to digest. Go vegan, basically, for a couple of days. Lots of fruits, vegetables, lentils, beans, potatoes, rice, and so on, and plenty of water. Really, really plenty of water, even after the session.
Can you do a sort of a half measure of cupping? So, for example, someone who may be in a more sensitive health state, someone you're maybe a little bit cautious about having this done, can you do like a sort of like a half treatment? Does that work as a way of almost like a taster?
Absolutely, we can. Yes, yes. And the first time, actually, we advise to not apply too many cups, because we want to see how the patient will feel, and we don't want the patient to feel absolutely exhausted. So we can, one session can be just 1 cup, actually. So yeah, absolutely fine.
And again, have you ever had anybody come to you who's maybe particularly nervous about the whole concept? They've seen the pictures, which, as you quite rightly say, don't do the process justice. How have you overcome that to really help them to undergo the treatment, because you know fundamentally it's going to help them?
So the first thing, people are usually scared and afraid because they don't know something. Okay. So the first step is to explain how this works and what they can explain. And then with regards to the process, sometimes I will use a cup and just show them on their arm, because they can see it and they can see what I am doing. And they can see that by pulling up the skin and not pinching it, I'm not causing any pain. Okay, so that is the first thing. And the second thing is that when I treat patients, they always have the option to tell me, stop, I don't want to go ahead. So this reassures the patients, knowing that they can ask me to stop at any point.
And the interesting thing is, as you've said and I've seen, that actually the sensation is pretty mild all the way through anyway. It's just maybe a little unsightly afterwards. One of the things we always love hearing on the show are patient stories. So maybe you can give us maybe a condition that was the most unusual condition that actually was still successful with cupping.
Unusual? I wouldn't say, well, yes and no. I had this young boy, for 13 years old. He's been suffering from migraines since childhood, but really bad migraines. That means that he was sick, impossible to go to school, impossible to sleep, couldn't do anything. So he came to see me, and obviously he was quite scared, but he came with mommy, who definitely pushed him. Okay. So I made sure, he was happy to go ahead with that. I've done 2 cups on his head. Okay, he was really brave, and her mom called me like a week after. She told me, no, everything is fine. He hasn't had any migraines, so on and so on. And 2 months later, I gave her a call, say, oh, how is your son doing? She said, guess what? He's never been like this. I've never knew him like this. He hasn't missed 1 day of school.
That is a fabulous story to finish on. Thank you so much. I love hearing great stories. And please do have a look at cupping. It's a great system, and it's a process that can really, really help you. And some remarkable results that we've just heard. Thank you so much indeed.
Thank you very much for inviting me.
But unfortunately, that is all we have time for. Again, I'd like to thank our guest today, who's done such an amazing job, Sondoss Zaouali, who, as you've heard, is a qualified medical nurse practicing wet cupping therapy. Now, once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. If you'd like to find out more about cupping or any of the subjects that we cover on the show, then please do email us at healthshow@islamchannel.tv. But for the moment, it's goodbye from me, and see you again next week. Assalamu alaikum.